It's now my pleasure to introduce Valerie Williams to facilitate the first session. Valerie, take it away.
Thank you, Mary Jo. Welcome, everyone. It's a pleasure to be with you today. I'm Valerie Williams, and as someone who's been involved in health professions education for over 30 years, I feel like I've gone through sort of every one of the models that Darren mentioned in his introduction. So today, if we can look at the next slide, I think what we want to explore, and the next slide, is setting the stage for this conversation, which is basically to understand that health professions education has continued to evolve over quite a long time. And through that process of evolution and change, health professions educators have confronted many, many challenges, often trying to move from the status quo through the anxiety and stress from understanding what's going on to really trying to shape what needs to happen next. And in that process, often different ones of us are engaged at different levels, but the system overall is moving forward fairly smoothly. For the next slide, though, what shows is that COVID introduced a remarkably different challenge for us. It introduced a challenge that everyone was invited to participate in all at the same time, and that threw a great deal of disruption and chaos into our environment. This is something where I think we have all also seen a remarkable capacity for our colleagues to rise to that challenge. And if we can go to the next slide, I would say it's important for us to recognize that that has been an awesome level of resolve and commitment that has been demonstrated by our faculty colleagues, by people on the front lines, and by all of the people who support folks on the front lines to ensure that what America was seeing, what the world was seeing, was a remarkable amount of compassion and extraordinary strength demonstrated by the people who have been engaged in not only trying to help patients who are experiencing COVID, but also those who are working to try to ensure that the educational environment could stay on track, pivot rapidly, move back on track as quickly as possible. I want to say here, though, how important it is for all of us to take a moment to remember to show the same kind of care and concern to our internal community, as for those of us who are in higher education and health professions education, as the community has been expected to show to patients and to society at large around the world in terms of that compassion and strength. When we share this set of values about honoring the fact that we are all in some process of dealing with challenges, dealing with our own fears and anxieties, still trying to show our best selves and come and show up every day with the intent to actually engage and do this work effectively, that is extraordinarily important to acknowledge, and to acknowledge internally, because that internal acknowledgement also helps us build the resilience that's necessary, the sort of the strength of a community that's necessary to actually see our way through this kind of a challenge. So this is prompted for us in trying to start this conversation about what we're learning through COVID in health professions education, and we can go on to the next slide, is that we are all experiencing this as a process of change. Change is not always a highly desired thing, and I think when we experience it only as individuals, it's something that we make some choices about. When we're experiencing it community-wide in the areas of our work, our home lives, our community lives, our practice lives, it can be an extraordinary challenge. So in this process, I want to talk about this, and our first session is going to look at this in the context of sort of three frames for it. And if we can go on to the next slide, you'll see those noted there. The first of those being incremental change. We can move the slide ahead, or maybe it's not moving only on my screen. Great, thank you. Incremental change, we are all accustomed to in some ways. Incidental change, we're all accustomed to in some ways. Intentional change, we're all accustomed to. Right now, we are experiencing all three at the same time, although each one of those kinds of changes is aimed toward trying to get us to a desired new state. And at times, it's very difficult to see what that new state might be when we are in chaos and when there are big disruptions going on. But let's think about change in terms of two contextual elements in particular. We can go to the next slide. First of all, mostly for people who are engaged in some aspect of change, the only two types of people that I know like change are largely these: people who design the change and people who are caring for the wet baby. And I only talk briefly just about each of those. People who design the change are those who see the need for some innovation, some adaptation, and they are ready to try to take those steps because it is very necessary and evident in their eyes. In the middle of that continuum, though, there are also people who don't see it that way and who are going to be in some ways resistant because they don't get it yet. And we have to understand that that's part of what's happening in our environment. At the other end of the continuum are the people who are, quote, caring for the wet baby, meaning they're people who recognize that something is wildly off the rails here and we must change it. The wet baby knows that they need to be changed. They can't do it by themselves, but the person who is the caretaker is the one who has to step in and help get that going. And so along that continuum, we have people right now at every stage of that because of what COVID has introduced to our environment. So if we can go into the next slide, COVID has introduced us to this idea that we can either be engaged at the design end or understanding that we need to take care of a wet baby kind of situation. And there will still be people in the middle, particularly with regard to COVID, because there is so much other that needs to change at a systemic level because of what Darren was talking about earlier, that this is affecting every aspect of the socioeconomic environment in which we are living today. So we are taking some lessons learned from how we're seeing the situation evolve right now. We can go on to the next slide. And that is, I want to just use this one little example. We started out using certain kinds of language to communicate what was happening. And early in the process, we talked about social distancing. As we have moved along in health professions education in particular, we've gotten a different understanding, and we're now talking about physical distancing, recognizing that the messaging of social distancing is contributing to loneliness, lack of services, lack of care, inattentiveness, et cetera, and that really what we're talking about is physical distancing. So we are seeing some of these things already in play. And I think health professions educators, because they have the courage to lead, health professions providers are showing the courage to lead, we are trying to get this messaging together and understand for ourselves how all of this works. Next slide, please. So let's start our conversation here with 3 quick poll questions for you all as participants today to think about when COVID started, what were your top 3 concerns before the pandemic truly came to light fully? What are your top 3 concerns now in the present during the pandemic as we are continuing to experience what's going on with COVID? And for the future, what do you anticipate will be your top 3 concerns for the future of HPE? The poll has been launched. If you take a moment to answer those questions. All right. So what we're seeing in the past, the concerns before the pandemic, we are seeing about 61% of folks were focused on learner assessment, competence, and feedback, and then technological capacity came in second. We're looking at what people's concerns are now, learner isolation, distress disparities that are occurring as the highest level, and then followed by safety issues. And then going forward, learner assessment, competence, and feedback, and our capacity for dealing with learner isolation stress. It brought something to light that we maybe need to think about even more. Excellent. Thank you so much for responding to those poll questions. I appreciate it. So that takes us to our next slide, because our speakers for today will be addressing aspects of each of these 3 from an experiential perspective. If we can move on to the next slide, that would be great. So our 3 speakers for today for this first session are Skylar Stewart-Clark, who is at Charleston Southern University. She'll be talking with us about her experiences during the pandemic as both an educator and a health professional providing care to patients, and as an individual faculty member engaged with life at large and what those experiences have been like. And for those of you who are fulfilling those roles within your own communities, please be thinking about how Skylar's experiences maybe resonate with some of what you have experienced yourself. We'll be inviting your comments during part of that presentation, which you can share through the Q&A. Skylar will be followed by Pinar Keskinacek, who is at the Georgia Institute of Technology. And Pinar will give us some perspective about using a systems approach to inform how we look at incidents like this kind of disruption and the system of health professions education within the larger industry of healthcare, to understand some ways that we can look at what occurs and how we might intervene on that. Pinar will be followed by Dr. David Daniel at James Madison University. David will introduce us to thoughts about how we move from just getting through the incredible disruption that this has created to really thinking about how we develop our tools for understanding and assessing what's going on and making some decisions about how we should be moving forward. So I encourage you to be thinking constantly about adding to the Q&A during these presentations. I will remind you of that as we move along. And Skylar, I will ask that you bring on your camera and turn your mic on as we are going to move to your presentation next. Skylar, are you ready? Put yourself up on screen.
Yes, thank you. Good morning. It is a pleasure to be here. And as Valerie mentioned, I'm going to talk about my experience in the pandemic or the syndemic, really through the lens of being a faculty, health professions educator, a clinician, as well as a spouse and a mother. Next slide, please. And so really, as I was reflecting on what I was going to share, I wanted to talk through some key principles or tenets that I think have guided my response in terms of how I have moved through navigating the course of the past 8 months. And so if you move to the next slide, I'll kind of share thoughts in terms of this concept of a significant seismic shift in everyone's cognitive load, whether you're a parent, a spouse, practicing clinician, a health professions educator. From my standpoint, I'm a mother of 4 children ranging from 2 to 13. One has pretty significant needs. And it was quite difficult to shift within a few days to working from home and managing all of their schedules. As a faculty member, I teach our patient assessment and diagnostic methods course, where students learn hands-on skills of physical exams, procedures, and ultrasound. And it was quite jarring to think about how I would shift within a week and a half to putting all of that 100% online. As a clinician, I practice hospitalist medicine and had found myself in the midst of everything else being called in for additional shifts, either because my colleagues were out with COVID-19 or to assist with surge capacity. And so like many of you, I felt isolated at times, quite uncomfortable and pretty unsure initially as to how I would manage a lot of the chaos. In reflecting and preparing for this presentation, however, I noticed that in many instances, I made some observations and I responded. And so I'll share with you in the next several slides, just some of those key responses. The first observation really was around how I was going to manage the load, the new load of stress, and really avoid burnout. I've got a picture of my oldest son who is on the autism spectrum, who had really significant increase in his needs in the virtual environment. And I can think back to one evening where I was feverishly working on a presentation for the next day, 9 or 10 o'clock at night, and he came to me and asked me to watch him play with his Legos, which are pictured there on his desk. And I paused for a second, but was able to go back and rely on just my overall values and in terms of how I was going to respond and what I needed to do and how I was going to decide. There's a book by Susie Welch called 10-10-10, A Life Transforming Idea. And the 10-10-10 principle is something that I had heard of in years past, but really started to internalize and act on in recent times. And so it really just presents this framework around your values and around decisions and when you feel okay about saying no. And so for me in that moment, I was able to just take stock of what the outcome was going to be in the next 10 minutes if I stopped and engaged with him, in the next 10 months in the foreseeable future, maybe no significant consequences. But really what resonated with me in that moment was in the next 10 years, he was going to remember that I pulled away from my work to spend some quality time with him. And so really there's this concept of being your own personal change manager and centering those decisions in particular around your values when you have competing demands coming from multiple different directions. You go to the next slide. My second observation was around the disproportionate impact on female faculty, something that we all know to be true, but something that I don't know that I had really experienced until as of late. There tends to already be this hidden yet somewhat symptomatic emotional burden of stress. In the context of the pandemic or syndemic, we know that everyone's responsibilities in some way, shape, or form had increased. And with female faculty in particular and caregivers, this was often in the context of less support in one or more areas of our responsibilities. In particular, I'm thinking back to when our program was positioned to return in some capacity to the physical classroom space, albeit with multiple constraints, and how I needed to rethink how I would deliver course content for procedures, for physical exam skills, and for ultrasound, realizing pretty quickly that there was one of me and I would have to offer multiple opportunities for our small cohorts of students to come through. What I opted to do, and initially we received quite a bit of pushback on, was to not only have the students engage in this hybrid type of learning experience, but really create this hybrid experience for faculty, making allowances for those of us who did have small children at home to feel confident that we were still able to carry forward a lot of our responsibilities in the context of COVID-19, and allowing for flexibility and creating this vision, but really more importantly, actualizing it and creating an action plan, I think, was key. I was quite pleased in the end and very encouraged to see the amount of support that I got, in particular when I spoke up. And past that, I've continued to target some other broad and really far-reaching policies, in particular that apply to women and other caregivers. So I would encourage everyone to just lead from a position of authenticity as you create space for these new innovative experiences. You go into the next slide, I'd like to share something that certainly can't be ignored and was highlighted pretty significantly in the polls that we just did. And that was around the disruption of our healthcare learners and the threats to their well-being. What I was able to reflect on was how my own experiences as a clinician allowed me to really empathize with my students. And I could think back to, at the peak of the pandemic, being called in to work additional shifts, and from one shift to the next, something would change. The setup of the hospital would change. The protocols were changing. The way we were communicating with one another, the screening protocols at the entrance, and there are countless other examples of those changes. And after a while, I started to accept the fact that something was going to change, and I was able to mentally prepare myself for this significant cognitive load. Our students, in a way, pretty significantly experienced the same. Our policies were changing. The way we were teaching or delivering content had changed. And so my response, which I share with my student, was really this desire to be as transparent as possible, to be as empathetic with my communication as possible, and where there was allotment in terms of capacity, to be quite flexible, which I think ties in really nicely with competency-based education. Ultimately, I wanted to send this message to my students as future healthcare providers, how important it was in cultivating grace. And so if you move to the next slide, I'll let Valerie chime in.
Yes, thank you. Thank you, Skylar. Really important points that you made and observations, I think, about your own process. Let me ask you, as we ask this question of the audience, and they can type into Q&A, their response resonated with them during this first part of the pandemic. So as you thought about the observe and respond approach, when do you feel like you actually noticed what was happening to you? Because I think we're so used to rushing in and just feeling like we have to respond. How did you step back and realize? Was it the incident with your son, or were other things also helping you recognize that?
I think the watershed moment in particular was the incident with my son, where I had to say, wait a minute, stop, let me take stock of where things are, because so many things had been changing and there were so many demands coming from multiple different directions, that was really an opportunity for me to take a step back and to reflect and really to think about, the 10-year legacy. What do I want? Where do I see myself? What do I want my children to remember? Where do I want my career to be? And are the choices that I'm making right now in line with that vision? So I think that for me was really key and sort of helped me shift my focus moving forward over the course of the last several months.
Thank you. I think maybe one of the things to take away from that is if we can prepare ourselves for that kind of, I need to take a moment and take stock, even if it's a little note on our screen every day or on our mirror, just as a reminder, because I think sometimes the crush that occurs with these disruptive events that have been happening just push and push and push. And it's hard to say, I need to breathe for a minute and really look at what's going on. So thank you so much for sharing that. Let me ask you though, as you take us into this next set of things, you did comment on what was happening with learners, and also noticing that they were probably experiencing something very much along the same lines, although pushed by different elements in their world of being students at the time. Can you walk us through some of maybe an example of something that you use to help get them back on track?
Yeah, I made it a practice to do social emotional check-ins at the start or end of class and engage them in a multitude of different ways. I believe the slide that was presented earlier showed them with their pets. And I just invited everyone to bring their cats, dogs, or what have you along with them on that particular day. So really just trying to give them a sense of community and belonging in situations where I knew that they were feeling isolated and out of sorts, which I think was helpful.
Great. Well, let's move on. We've got about 5 minutes left in this segment. So Skylar, take us into the next example that you have for us.
Sure. So I've talked about kind of the three main tenets, but the one major response I think that was quite powerful that many of us have done in one way, shape, or form is use our experiences to inform how we choose to respond on a greater level. My clinical practice was a great source of information for me in terms of addressing some felt needs. I had been thrust into practicing telemedicine and found that as a great opportunity to transition and translate some of that information into my coursework, particularly during times where my students were learning virtually. And then in addition, I had seen this surge in individuals presenting to the hospital with exacerbations of chronic diseases simply because of loss to access to care or running out of medications. And in this context, we also had students who just had a heart of service but had nowhere to serve. And so if you move to the next several slides, I'll kind of talk through what was birthed out of this experience. We created the project Learn to Serve, which is a socially distanced service learning project. You can move to the next slide. This was in conjunction with a local safety net clinic. Our didactic year students, as a part of a course, served for 6 hours on a Monday, Wednesday, or Friday between August and November of 2020 to try to help close this gap. They screened more than 200 patients who were diagnosed with either diabetes or high blood pressure who had been lost to follow-up over the course of a year, and triaged them based on telephone or video conversations into an emergent, urgent, or routine disposition based on the decision tree, and particularly based on symptoms or areas where their blood pressure was uncontrolled or diabetes was uncontrolled. And so if you move to the next few slides, I'll talk through some of the outcomes. We increased the clinic operational capacity, increased telemedicine visits, strengthened the chart review process, and was able to help the clinic transition their internal processes to a place of higher efficiency. Next slide. Our students had profound outcomes in terms of what they were able to take away and really seeing some of the public health aspect from their own perspective. And then if you go to the last slide, as we're running out of time, just final thoughts are that in many ways, the pandemic has highlighted what we already know to be true about meaningful growth during challenging times. And so I would leave you all with the charge to prioritize with a values-based strategic approach, to lead with authenticity and question the system, to communicate with empathy and transparency, and to respond appropriately to your felt needs. Thank you so much.
Thank you so much, Dr. Clark. That was excellent. We appreciate you framing the experience that you've had and giving us a sense of how faculty are trying to balance those clinical responsibilities, teaching and home life, as well as to encourage our learners. I'm going to continue inviting participants to join with their thoughts in the Q&A, and we will either answer those along the way or we'll respond to them later on in the program. We also, just to let everyone know, the slides will be available, as will be a recording of the session. So let me now turn to our next speaker. Pinar, if you are ready, please turn on your camera and your microphone. Please, everyone, welcome Dr. Pinar Kiskinacek, who will talk to us about systems thinking in healthcare and health professions education. Pinar, I turn it over to you.
Thank you, Valerie, and good morning, everyone. Thank you for joining us this morning. So health professions education is at the heart of a complex web of systems which affect our health, how we live our lives, and everything else. So next slide, please. So these systems include individuals and the physical systems in our body, where, with whom, and how we live our lives, the organizations which support our care, our day-to-day lives, our workplaces, schools, faith institutions, and others, and also the various environmental factors, regulations, policies, socioeconomic conditions, culture, global warming, you name it, or climate change. So to design and run an effective health system, we not only need to understand the features and characteristics of each part, but also how these different parts interact with each other, fit together. Next, please. So health professions education, I may use the acronym HPE, is a keystone in these systems of systems, interacting with each part. How we design and deliver HPE has a significant impact on the health and well-being of individuals and the population. And this is not only for today, but also for many, many generations to come. Next, please. So historically, our focus in education and delivery has been primarily on treating the sick. But it's well established that medical care is not sufficient for ensuring better health. Its impact is limited to about maybe 10 to 20% of the healthy outcomes for a population, but the other 80 to 90% rely on health-related behaviors, socioeconomic factors, environmental factors. And COVID-19 underscored these weaknesses in our healthcare systems and also the challenges for HPE like never before. We've seen that pre-existing conditions have been associated with significantly higher risk for complications due to COVID-19. And this highlighted the importance of promoting healthy lifestyles, prevention, and also non-pharmaceutical interventions in case of an outbreak such as this one. So combining our learnings from COVID-19 with a systems approach, we have an opportunity to be intentional and rethink health professions education so that not only we can better respond to future crises, but also provide better care during normal times. For example, how do we better enable team-based work and better integrate HPE with practice? How do we build multi-sector partnerships? How do we shift the conversation from the leading causes of death to the leading causes of life? How do we better integrate physical and mental health? How do we adopt a competency-based approach to HPE? And which core competencies or topics to include in our curriculum? Maybe some of the topics will de-emphasize, considering both the current and also the future needs across the system. So now we are going to have a short poll asking you to share some of your thoughts about the topics or core competencies that we could include in our health professionals education. So this is just a short limited list. I would encourage you to please write additional thoughts, topics, core competencies that you think will be important moving forward in the Q&A. And we will share these results with you a little bit later in the workshop. So next slide, please. So as we think about the future of HPE, let's look at a few characteristics of complex systems with some examples relevant to HPE. So we already mentioned COVID-19 underlined the complexity of balancing multiple stakeholders, perspectives, objectives, and trade-offs. So for example, providing in-person versus remote versus hybrid instruction, if and to what degree to involve learners in patient care, considering health and safety of the learners, as well as patient needs and also the learning opportunities. There is often a high variability in a complex system, even for activities that seem similar. Some educators might be doing what they have done 20 years ago, others may embrace new models or technology. And there's almost always some variability in who knows what and when. This is not always a shortcoming, but it requires a careful balance as to which information should be communicated to whom and how to ensure the efficiency and effectiveness of the system. Uncertainty and disruptions are no exceptions, so we need to be prepared for change, as the previous speakers emphasized in their presentations, and also be intentional and systematic in our preparedness and also response. An individual or a subgroup might optimize what they do from their own perspective, but not necessarily considering the system-wide implications. And this might have unintended negative consequences, as we will hear from our next speaker some more detailed examples on this. So just as an example, as an educator in a clinical setting, a person might want to teach extensively during rounds, but this might delay the completion of the rounds and in turn delay discharges, which then may lead to crowding in the emergency department and delays in the admission of new patients. So what seems to be a good thing from a narrow perspective might actually have unintended negative consequences in the system. So we need better visibility about the impact of an action in one part of the system on other parts of the system. And we also need to combine these with proper incentives and effective communication to ensure that the choices of individuals or subgroups align with the overall system's objectives. So operating in silos, whether we think about delivery or education, does not work, especially not during a crisis. So we need a rapidly learning, adaptive, responsive health professionals education approach, well integrated into the health systems to best meet the needs of the learners and the population today and in the future. All right, so let's take a look at what systems engineering does. Next, please. It follows a structured, unified approach to improve or redesign systems considering multiple decisions, stakeholders, objectives, and constraints. So as an example, consider childhood asthma. Let's say we see a high number of children coming to the ED with asthma attacks and experience long wait times. We could look at the long wait times as a symptom and try to optimize how we care for these children in the ED to reduce the wait times. This would be an example of silo thinking, not system thinking. So instead, next, if we could focus, instead of focusing on the area where we see the symptoms, if we could actually expand our vision and focus on the root causes, we would try to prevent asthma attacks, keeping the children healthy, and reduce ED visits. But to do so, we really need to think outside the box, including where the child lives, air quality, access to nebulizers, inhalers, or other medications, health management education, and so on. Next. So when these other parts of the system work well, next please, we may significantly reduce the number of children who end up in the ED due to an asthma attack. And we use a variety of methods in systems engineering so that if we would like to make a change in the system, we don't have to test it live, but we can actually evaluate, quantify, and understand the impact of a change using some of these analytics methods. So that way, when we implement, we are much better prepared and better understand the potential consequences. Next, please. Systems engineering has been widely used in other industries to improve efficiency, reliability, quality, and safety. And we would achieve similar benefits from more widespread adoption of systems thinking in health professions education. This would enable us to better address challenges such as disparities in access to care, the needs for the aging population, and so on. These are very complex issues and beyond the traditional patient-provider interactions. They require collaboration across multiple entities. So including systems thinking as part of health professions education has the potential to change how we educate the future generation, how we design our systems, and how we deliver care, hopefully towards happier and healthier individuals and populations. Thank you.
Thank you, Pinar. That was an excellent overview, and I really appreciate your comments about how we look at siloed versus systems thinking and how crucial that is to think ahead about that, because in the midst of chaos, it's more likely that we're going to head back into siloed. We go to that comfortable place. So having the systems thinking framework as we look forward to what's changing with this pivot for health professions education is a fabulous point for us to keep in mind. Thank you so much. Let me just make a note that we will be answering questions in the chat. We will bring up some, in the Q&A, and we will bring up some for live response as we have an opportunity in the time of this segment. But right now, what we're going to do is to turn to David Daniel. David, if you would put on your video and turn your mic on. David is going to talk with us about how we move from surviving to thriving. David, are you ready to go?
Sure am. Thanks, Valerie.
Excellent.
Hi, everyone. I just wanted to basically point out that we're using the Q&A the way most people use chat. So as I'm going through the presentation, if you have questions or comments, throw them in the Q&A and we'll try to get to them as best we can during, as Valerie said, with the time allowed it. So I'm coming to you from the perspective of a health educator. And we've heard from several people already about how difficult it was for everybody. So this idea of being a survivor next is pretty much out there for us, right? And that's a nice analogy. The thing about survivor is you go in there with a strategy kind of prepared for what you're going on next. So when it comes to health professions education, what we really were faced with rather than survivor next was more like naked and afraid. We ended up having things come at us really fast without preparation, sometimes without tools or the right tools. And it took us back. It took our students back. It took everything back. And what I really want to talk about is going forward. And going forward, we need to kind of address what we were doing and what we have been doing and where we're going forward. So some questions I'd like you to have in your back of your mind. And also, if you want to throw some answers to these in the Q&A so other people could see it, that would be great. Next, two up. What issues or opportunities did you face as you transitioned? We asked this in the poll earlier, and there were some other things, but get that in the front of your mind for the rest of this presentation. What were you faced with as this hit you personally? Okay, as in your professional job, professional aspects of your job, I should say. Next, as we're doing that, how did you know which to address and which to not address? How did you triage all of this stuff? Next, okay. How did you address them? There's a number of ways. After these things started to happen for me, for example, people were throwing tools and suggestions and this technologies and that technology and this issue at me. I had to triage all that stuff. I had to make my choices about how to address them. And over time, I have to now find out, how do I know that those adaptations actually worked? And that's kind of what we're going to be talking about right now. Keep in mind, this is not a talk on how to do assessment. This is a talk on what to think about when you do your assessment, and a reminder that you should be. Sometimes when we're overwhelmed by these things, we don't think about the assessment part, but we need to tweak things. That's what good teachers do naturally anyway. We just want to formalize that. It's also important for us to pick what we're going to point our lasers at, where we're going to be focusing our efforts at next. So what I'd like to do is to give you a little story about the war on hunger in the 1950s and 60s in the United States. And the target of that was actually people who were hungry, right? So we had a bunch of people who were hungry. We had a new interstate highway system. We had some newfound wealth. We had food being grown. We need to get it to the people who were hungry. Next. Okay. These questions were framed around some very familiar to most of us issues: accessibility, affordability, convenient, would it be usable, and was it we would call it engaging, but was it tasty to make you full? Did it solve the problem we were trying to address? Okay, so let's look at accessible first. We had all this information, well, all this, I'm talking about teaching already. We had all this food in certain places that we couldn't get to other places before it spoiled. We had no efficient way to deliver our product. We had to figure out ways to do that. Next. The nice thing is we just had developed this wonderful way to get things all across the country, roughly like the internet and a bunch of other sorts of things. And we wanted to leverage this to make things accessible. Next. We also need to be affordable, so when it got to its endpoint, the people could actually take advantage of using it. So we had to find out how to make it accessible to people, how to make it so they could afford it. Next. And how can we make it easy to get? Going back to that market, going different places, how can we make it convenient, easy to use? Next. This is what we got. Some of you may be old enough to remember these. They came in foil, we put them in the oven, and this was the result actually of part of the war on hunger. These were accessible, affordable, easy to use. They're missing something really, really important, and that is next, taste. Okay, so they weren't engaging. They didn't taste very good. I remember eating when I was little. I didn't know what they were because you couldn't tell what the food was, but it was food. Okay, so it got 3 of them, but not the 4th one. So we had the problem with taste, but we already had the other 3 dealt with. So what did we do next? We engineered taste, just like we engineered the accessibility with chemicals and preservatives and things like that. We added to this chemicals that made things taste like something. For example, do you remember the red popsicle you may remember when you were little, or if you're not so little, the cherry popsicle? That's a taste that doesn't exist in nature. But we engineered that. It was engaging and it solved these problems. The analogy here next, okay, is to what we had to do with technology and other sorts of things as we adapted to COVID. We won the war on hunger. Easy, cheap, engaging, tasty. Look at what we got. Okay, we won. Okay, wanted to point that out. Next. Our target, remember, it was people who didn't have access to these things, tended to be people without a lot of money. We created these places that are full of easy, cheap, engaging, filling foods. And some place where there's none of the fruit, none of the stuff I showed you in the first slide. It was junk food. It was engaging. It fit all. We have food deserts now. The question for us is, as we're moving forward, is to make sure we don't create education deserts going forward. If you look at these, what's the variable that's missing? Okay, you use the Q&A if you want. Accessible, affordable, convenient, engaging. What's the variable that it's missing for a really, really positive war on hunger? Anybody got any ideas? Oh, okay, some of you are saying it out loud. Next. Nutrition, exactly, right? We didn't include nutrition as our target. We included being full, being not hungry as our target. But having the wrong target, or part of the wrong target, not including other things in our target, next, we created a lot more issues. And those issues are all a consequence of us choosing to solve one problem to the exclusion of thinking about the other problems. And this is why it's important, because as we did that, not questioning it, not moving forward, we built upon those mistakes and compounded them and built them into our system, as opposed to challenging them and evolving them to making them better. And those problems that we're talking about, obesity in particular, right, which is at the root of a lot of these things, it became part of everything. Right? In education, are we doing this now? We have to think about this as we're moving forward. Okay, what are we going to bring back? Right? What are we going to lose next? Right? Remember, this also brought us no more cooking from scratch, eating out of boxes, learning out of boxes, those sorts of things. We want to make sure that what we're doing is generating the kind of impacts on our students. And in health professions, remember, we need durable knowledge. The knowledge also needs to be flexible across contexts. It also has to be usable in context. So we have a very high standard. Out of the box may not work, no matter how good your UI is. We need good thinkers, good doers. And that's a very high bar that we have for health professions education. And COVID made it very, very difficult. Next. So our lesson really here is pick your goals wisely. And you notice that's plural. Right? It's plural because one goal usually affects other sorts of things. We've been talking about systems thinking today, and we all are part of a system. There's no way we can think about it. For example, if we just look at the answers to the poll questions up front, people were very, very concerned. I wrote it down with learning assessment competencies. And in the next one, they were also concerned about the socio-emotional well-being of their students, because they started to see sides of their students and stresses on their students that maybe hadn't popped up to that level in the triage list until these things started to happen. That's all part of the system, right? They all have to work together for us to be successful. Next. Okay, so some of these goals, we can look at efficiency, we could look at impact, we're going to look at practical utility. We're going to be looking at all these right now to talk about it. Usually when we talk about efficiency next, most people are talking about economics. Right? And economics isn't something we can ignore. But it also shouldn't be the sole arbiter on what works and what doesn't work. Right? We need a cost-benefit analysis for everything. There's other sorts of things involved in economics. Next. There's also effort. For example, is this intervention worth the effort? There's effort from the students, cognitive load, as Skylar was talking about earlier. There's effort from the educator. There's effort from the system in order to support that. It's not just money, it's the effort. Next. It's also the time. Time and effort aren't the same thing, right? Does any of you know whose students have been told you they studied for a long time, but maybe not the right way or with as much intensity as they should have, right? But time is very, very valuable. Nurses, for example, education has to happen for nurses. They're doing 12-hour shifts. The nurses are often educated at the end or beginning of their 12-hour shift. Time is really of the essence. It's important. It's something we all need to think about. Skylar told you, you need to think about it for you to make sure you have time to take care of yourself so that you can take care of the other people you're supposed to be taking care of and educating them. Okay. So time is actually another kind of efficiency we want to be looking at, not just money. And lastly, on my list, there's other kinds. We want to look at impact, right? Are we getting the impact we want? What we're seeing here is basically the makings of a cost-benefit analysis. Are your efforts, is your time, are the resources that you put into these things to respond to COVID, in the long run, as we're getting into a groove, right? And you're going to come back and think, what did I learn from this? Were they worth it with respect to impact on you, impact on your students? I study learning. I'm all about learning. So did it get you the kind of learning that you wanted? Did it get you the impact on your target that you wanted to? Next. So it's really important for us to note right off the bat, teaching and learning is messy, right? It's a very, very complex thing. If you look in the bottom left-hand side, I think it's your left, you're going to see motivation, cognition, and emotion inside a brain. Right? I studied cognition. Skylar talked about socio-emotional. Can you ever really tease the two apart in a real life person? No, they go together. You know, emotion is the cognition, is the fire beneath cognition. So even though we may study these things in silos, they work together inside the person in front of us, the person we're educating, and inside of us as a system, as an interacting dynamic system. So when you look at your students, you understand this is a very, very dynamic system. Picking one variable over the other to affect could impact the other variables. In medicine, for example, there's a book by Susan Mullen called The Best of Intentions that highlights a lot of fixes from medicine that actually created more problems than they actually solved because they were looking at one variable. For example, people who have low iron, who live in rural areas, given lots of iron, it's a supplement to help them with that. But iron feeds bacteria and it actually increases problems because it didn't look at the context. So as we're looking at our variables, we want to be really, really careful to look at interactions. Everything has side effects. Some side effects can elevate your treatment, some can suppress it, right? So we want to look at that as educators. I'll give you an example. Next. Let's say I'm a researcher and I'm studying drilling. I put math facts on here, but this could be, your students who walk around with all those flashcards all the time, trying to get their medical terminology, drilling over and over and over and over. What's the research say about that? Well, if I'm studying learning, just learning, do they learn their math facts? It completely works. If I'm studying sucking the soul from the learner, it completely works too. Usually those aren't the same instructor. So by moving away from my core variable to things that are important for it to work, I'm getting a better picture of what I should be doing and what I should not be doing. Next, let's actually go to. Okay, so the lesson here is pick your target wisely and then measure around your target. This dartboard, if it was up in your basement, okay, you're gonna hit things around that. You wanna build around that target so that you understand what's going on and protect your wall and protect your class and protect your learning and protect yourself. Measuring around it, look at the emotional consequences, look at the cognitive consequences. I can get a lot of learning on these online platforms, but I also can totally fill up their cognitive load to the point where it actually suppresses the kind of learning I want because they're really busy trying to interact with the system as opposed to interact with the information or the skill I'm trying to get them to develop. Remember, our goal is usable knowledge in health professions. Next. The other thing we need to think about is practical utility, right? Not just statistical utility or things like that. There's a couple questions we should be asking ourselves. For example, when someone comes to us with something we should do next, does it solve a problem we actually have? Migrating back when this is all over, whatever this is. COVID is just the first. We're going to have other pandemics, other sorts of things happening to us. We're going to bring some of these lessons back to our classroom. Did our fix for this solve a problem we're going to have then? It's a really important question to ask. Next. How much improvement will we get? Right? And that's important when we look at cost, if we look at the effort, look at the time, those sorts of things. Okay. Next. Next, Hannah. Okay. The next question, will it work in your context? Super important for you to ask. Okay. Next. So let's look forward to 2020. Well, to the next, to 2021, actually. Stock slide. All right. As we're moving forward and trying to think, what lessons have we learned doing our adaptations to COVID? What was our goal and what is our goal moving forward? The goals may have shifted. What is our goal is really important thing to ask because our goal is going to impact the system that we have to work in and other parts of the learning context. Next, was it working well before? Before could be before COVID, because sometimes our goal is just to go back to what we consider was normal. Was it working well before? Is it worth going back to that? Or is what we're doing now working well, or back if we go back to that? Is it working for who? Is it some people it's not working for? Okay, next. Okay. And will the new way work better or different after this is over? All right, and what are the side effects? All right, that's really important to think about because you want to evolve your teaching, you want to evolve your practice. Thinking about it in terms of what this is working for this, but not for that. It's a really important thing to think about as you're moving forward. Because what's our goal next is getting back and then being able to respond again and scale up. Because if this happens again, we want to be prepared. We want to know what process to go through to rev up and to attack the problems at hand. So now's the time to be thinking about the future, about where you're going, and assessing what you're doing now to improve it. All right. And the last thing I really want to talk about is resource and planning. We've got that, but burnout's really important for you and for your students. We all have to work harder, students as well as educators. But Skylar made a really, really good point that we have to step up, but we can't step out of ourselves to do it. And we can't step out of our own lives to do it. Our lives just have to change. And it's a really important point that she made. Okay, so that said, Patricia, if you can put some time in the chat so I know how much time we have, I'll know what to do. All right, let's move forward with a couple questions for you. Okay. How do we know what ways we adapted? You adapted some ways very formally, and there's other ways you may not have adapted very, very formally. Take stock of what you had to do to make this work. Decide if that's what you want to do next time you have to rev up. How can you make that more efficient? And kind of make a list of what you had to do, because it's hard to keep track of, right? If these adaptations worked, next, think about who they did work for, who they didn't work for, so you could tweak it, including you. Did they work for you or not for you? They could have worked for other people, not for you. Now's the time to think about balancing that. Which goals did they work for, and which goals did they maybe not work for so well? Did they exacerbate old problems, right? That's another thing to think about. When we go back to something, maybe whatever normal is going to be, did your adaptations, if you bring them back into your classroom, exacerbate problems you already had? Or, for example, DEI is a great one. Did this actually increase up? And how do we know, what do we know when this has ebbed so we can move forward, so we could do it next time? Next. Okay. That's the formal presentation that I have for you. I didn't see anything in the Q&A that we need to address, but keep in mind that we really want to be looking at what we're doing now while we're doing it, so we can take stock of what's happening in real time to move forward.
Excellent. Thank you, David. That just, again, I think the examples that you provided to lay the context for what we're looking at now in terms of any time that we've tried to intervene on an issue and what the unintended consequences can be if we're not thoughtful about looking at the interaction between the decisions we're making and what we're really trying to get to as the endpoint. So let me invite each of the panelists to come back online for just a minute. There are a couple of questions in the chat that I'd like us to try to tackle live. And I've highlighted those on my screen, so I'm going to read them out. Beginning with actually a comment and then moving on to a question. Allison commented, I think most of us don't really get an issue that adversely affects others until it happens to us. It's not that we're terribly selfish, it's that the personal experience that most affects our understanding is in a way that hearing about an issue may not. So I think, Skylar, you tackled this a bit in your presentation about bringing things forward to leadership to have them understand that there might be some things we could intervene on. Do you want to comment on that for a moment?
Yeah, I just think it is so critical as we are making those observations to, I think this kind of fits well in line even with what David was saying as things happen, to make note, to do a post-mortem analysis, if you will, but then really to take an actionable response as we are witnessing how our experiences are affecting us and others that are similarly situated. I think it's incredibly powerful, and I think that we've seen incrementally is just some of the things that I've commented on that we know that they've been happening, but again, until it happens to you, it's not necessarily on your radar. But I think this is an incredible opportunity to move some things forward that have been happening incrementally in the background to the forefront to really bring about change in a meaningful way.
Thank you. Thank you. One of the questions that was raised by Warren was that Warren notes that since 1985, I've worked in home health nursing, thus my bias. regarding a systems approach to HPE, what might providers across the spectrum of care at home do to better collaborate with academia? What steps can we take to enhance curricula to include robust care at home experiences across health professions education? So anyone actually can take that from our three panelists. David, you want to give it a shot since that was sort of speaking to what you were talking about?
Could you reframe that a little bit, Valerie?
Sure. So for someone who is a health professional who works in the home care environment, how can there be better collaboration to bring together what's happening in health professions education broadly with experiences that the learner might have around care that needs to happen for a patient in the home care environment?
You know, what's really interesting about that is what you're talking about is a translational model from one setting to another setting, which medicine actually has a model for, but as educators, we don't have a good model for, right? So I can't give you a really good answer because there actually is not a good model for me to say, look, here's the steps you take, right? You're moving from a role-controlled setting to a different, maybe more complex setting. It's exactly the problem we have going from the lab to the classroom, right? What I would say to answer that is to start talking, and I know this is going to sound cliche, but start talking to your system about this exact issue, because number one, you're an evidence generator. You're not just an evidence receiver, and you need to be part of a feedback loop. Just as when we give a medicine to a doctor, they need to give feedback before it goes OTC, right? Yeah. So you are an evidence generator. Work on have a system where it's coming to you. You're trying to adapt it to your situation, and where that works or doesn't work, you have a way to feed that back in the system to help the people you work with.
So creating a feedback loop, I think, again, is the key point. And I would bet you that in a later presentation during today's workshop that maybe Nancy Spector will be able to address some of that in her remarks. Excellent, great. Maybe time for just one more here. You all put some really excellent thoughts and questions into the Q&A. Let's see, so here we go. Oh, with regard to, Natalie mentions, and with regard to instruction and practice, I think we as healthcare practitioners have all perceived the imperative need to be vigilant about infection control. This issue has presented itself both in instruction and in clinical settings. I think that was more of a comment than a question, but again, maybe something that in terms of a systems level approach, we think about these key items that continue to resonate across the full spectrum of education and practice and try to bring those to light a bit earlier. Does anyone want to comment further on that note?
It's a very good comment.
Yeah.
But before we go, is it okay if I comment on Joyce Morissette's question?
Please.
So Joyce Morissette brings out the idea of trauma-informed practices in education. And she also brings out that there's a physiological component to this, not just toxic stress, but stress in general. So we know about the brain. Some of you know about the brain. We all had Maslow's pyramid at some point in our training, right? And when our students are stressed, or when we're stressed, we're gonna be going down the pyramid to where that stress is coming from. So as an educator, it's important for us to actually create safe places. And the hard part is being safe and authentic at the same time when the stress is on us too. So we want our stress to, we don't want our stress to be contagious and compound the issue, right? So it's really important to note that these safe places encourage learning. Head Start was a safe place where you got good food and safety, everything, so that you can do the work of learning. We need to make sure that our learning contexts are the same.
Excellent. So let me, by way of closing, say thank you to each of our panelists for this session. Skylar, Pinar, David, you did a fantastic job sort of highlighting what we need to think about as we start this conversation about this pivot point for health professions education, as we are learning from and continuing to learn from the experiences related to COVID. I think a key point that was brought out by everyone is the fact that we are all experiencing this at the same time and under the stress of what's happening around us and with our personal lives and our professional lives, that we also need to recognize that some of our capacity for dealing with this kind of demand on us within the system is also to acknowledge that everyone is living with the stress of the moment, and that some advanced preparation is really important, along with reminders that say to us, you need to step back for a moment while you are in these moments of chaos to really do an active assessment of where am I now, what do I need to prioritize, and how do I need to think about what to do going forward, and to share that information with my team. I think Pinar's point about how much we are siloed, I will echo the point that having been in interprofessional education for a very long time, we retreat to our silos because we retreat to things that are stable for us when we are under conditions of stress. And so that sort of counter intuition to not retreat, but rather to press forward and to lean into something and to lean in with our colleagues, again, offers us the strength of the community and the community of practice to really help us understand what needs to happen next. So Skylar, Pinar, David, you did a fantastic job. Audience and participant members, thank you so much for the comments that you've shared. While we are on break, I will ask that we take a look at those questions that we have not yet answered live, and we will type some answers in or try to certainly preserve these questions for the substance of the workshop results. I will ask everyone to please do not exit the webinar while we move into our 10-minute break. Please stay in the webinar. Please, though, give yourself the moment to stretch, to do what I say to my leadership fellows, shake a tail feather so that you're not sitting for too long in this kind of environment. And when we return, Mary Jo and Darren D'Agostino will take us back into our next session. Thank you all so much for your attention during this segment, and we will move to a 10-minute break. We will see you in the next 10 minutes. Take care, everyone.